Welcome back. Just want to take this opportunity to tell you a little bit about our visiting professor, Dr. John Anderson. Dr. Anderson's a Michigan native, went to Ferris State University. Is he a Bulldog at Ferris State? Then he went to Michigan Medical School.
Didn't think I'd hear that.
Yeah, Northwestern for orthopedics, and then developed an interest in foot and ankle and was off to Harborview to do foot and ankle fellowship. He then returned to Michigan. He's been at Grand Rapids for most of his career since then. He has been very active in education of medical students, residents, and he's co-director of the residency program and also director of the Foot and Ankle Fellowship in Michigan. He's educated over 200 foot and ankle fellows. Research-wise, he's published more than 100 scientific articles as well as chapters. So he's very well accomplished in research. And clinically, he's always ranked as one of the foot and ankle surgeons, not only regionally, nationally, but also internationally. I think it's often said that our success should be measured by the products that we produce. As you know, Dr. Swatsky trained with him, and I think that's confirmation for Dr. Anderson's success. So please join me in welcoming him as he talks this morning on a long, strange trip. Dr. Anderson.
Thanks, Kevin. First, I'd just like to thank you guys for letting me come here to be with you. I mean, this is a very, very big day for the graduating chief residents. It's not probably the biggest day of your life, but it's certainly one of the more memorable days of your life. And it's really an honor and a privilege for me to be able to come here and see your program and meet you guys and help congratulate you and send you off. And kudos, what a tremendous program. I'm so impressed by the research quality and the quantity that's coming out of this institution. And I think that's a testimony to your leadership. But this day, as I was putting together ideas for what to talk to you about, I know this day typically involves people from all specialties, and I thought I'd put you to sleep if I started talking about my project of KOH slides to diagnose fungus toenail infections. So I wanted it to be something that you could remember, and it's not about me, it's about you guys. And I think there's a lot in here for the younger residents as well. It's not just for the seniors, but it's really about the seniors. So congratulations on a job well done. It's a tremendous accomplishment to get here. We've all struggled through high school to get good grades to get into college, and we've all struggled through college to get good grades to hope we get into medical school, and we've all struggled to be the top of the class in medical school, and we've all been fortunate enough to get our dream job matching in orthopedics, which is one of the harder specialties to get into, and you've completed 5 grueling years. That is like mortar fire in the trenches. So your long, strange trip is just beginning, but I figured my talk would kind of tailor around what a long, strange trip we're all on, and I'll highlight some of the long, strange aspects of my life, but I think there's a lot of corollaries and a lot of similarities between this trip that I've been on and the trip you guys are in the middle of right now. So congratulations to all 5 of you. You're all rock stars and should be congratulated for all of your efforts. It's tremendous. A day like this can't go by without acknowledgments. I think we walk on the shoulders of those that preceded us, and you got a lot of giants who've carried this program to where it is and allowed you to get to where you are. And that includes the faculty, the staff, your classmates, your own classmates, even the undergrads below you. They've helped you in so many ways. I think the apples don't fall far from the tree. So you should give your parents a big hug for what they did to get you here. They had a lot to do with this day, and they should be commended. your family members, your mentors, your significant others, they all have to go through so much for you to get to where you are today. So just make sure you thank the people for where you are that helped you get to this point. Without these people, we'd never get to the heights that we get to. So my message to your class, I'll start with a little intro about myself. I got a few short stories that I hope don't go too long. Some things I've learned, and I'll share some parting thoughts. So as Kevin mentioned, I was born and raised in Grand Rapids, grew up on a farm, poor family, large family, didn't know we were poor. We had riches in other ways, but we never felt poor. But in hindsight, I was probably one of the poorer kids that I knew. I just didn't know it. Yeah. And in Michigan, you're kind of split down the middle. You either root for Michigan State or you root for Michigan. So it's go green or go blue. My family, despite being a family of farmers, tended to root for the blue team, even though Michigan State was an agricultural school. So I always found that kind of interesting. And I was fortunate enough to match at the University of Michigan Medical School, which really opened my eyes to a different way of life and a different thought process and a different level of intensity and diversity. People from all over the world and people who are just so smart. So I thought I was pretty smart. In reality, I was very average. And my classmates at the University of Michigan really opened my eyes to all the opportunities that are out there. I was going to be a family practice doc in Lowell, where I grew up, and that was kind of my dream. And then I got to Ann Arbor and it's like, wow, there's all these different things out there. And it took me a while to figure out that orthopedics is like the coolest job in the world. And I was fortunate enough to be successful in medical school to match in orthopedics in Chicago. And now I'm really out of my wheelhouse. I'm way over the tip of my skis because small town West Michigan to Ann Arbor was a big jump. Ann Arbor to Chicago was a huge jump. Yeah, I got introduced to a whole lot of things in Chicago. This was my graduating class on our graduation day, one of the most memorable days of my life. This was my chairman, Mike Schaefer. Some of the people in the audience remember Mike Schaefer, but he was just a phenomenal guy who recently passed away. And he affected me in so many ways. I didn't realize it until he passed away. And I went to his funeral, as did just about every resident that graduated Northwestern. They flew in from all over the country, and this man affected a lot of lives, and it was just a tremendous experience to see how much honor and acclaim this man received after he passed away. Chicago introduced me to street violence, which is something I'd never seen. Yeah, this guy actually had 7 12-gauge slugs in his body. I got 5 of them on an AP pelvis. 2 of them were up in the kidneys. So somebody reloaded. Yeah, but I say all this just because I want you all to think about where you started. We all came from a background where we all had poopy diapers at one time. And this is the youngest picture in existence of me. This is my older brother giving me my first award. Obviously, I was very happy about that. I didn't bother to change my clothes in order to get this picture taken. This picture, I think I was 1 year old, and it was about a year later, I lost my left eye in a traumatic accident. So this is just a few years ago. This is my wife that I met in Chicago. And a lot of what I want to talk to you about is work-life balance. And we've hit all the highlights today already. We've talked about sleep cycles, and we've talked about joint maintenance and physical health and nutrition. Well, that all comes into work-life balance. And somehow as you get through this process and you get on your journey, one of the harder things you're going to struggle with is work-life balance, because we're all so type A and we all love our job so much. You just can't get enough of it if you love your job that much. But at some point you got to turn the spigot off, and you got to devote some time to all those other things that go into life balance. This is my first marathon I ever ran when I was a chief resident, and I was not a runner. The 2 guys in the picture were. I got coaxed into this. I made a foolish decision and said, yeah, I'll do it with you about 2 weeks before the race. It was one of the more miserable experiences of my life. I can look back at it and say I was overconfident and underprepared, and it cost me. I could barely walk for a week. Yeah. And I swore I'd never run another race in my life because it was just such a miserable experience. It took me a while to figure out it was my overconfidence and my under preparation that made it the most miserable experience. I went on to the University of Washington where I did a foot and ankle fellowship and saw all kinds of beautiful things that were brand new. Alex is very familiar with this picture. It's Harborview Hospital. That was the view out of the office that you get to enjoy every day. Absolutely fabulous. I discovered great coffee and lots of wilderness and beautiful bridges, and certainly enjoyed the life side of the work-life balance, even though we worked very hard and I learned a lot of things. I got to do a lot of things that were very memorable. This is actually looking over the hood of Mount St. Helens 15 years after it blew. So that was the baby lava dome that was rebrewing. And to get that picture, you actually had to crawl over a cornice with somebody strapped onto your feet with a rope. Because you're about 20 feet off the edge of the cliff. And who knows what that cornice is going to do when you crawl out there. But got the picture, got back as fast as possible, and lived to tell about it. These were my mentors in Seattle. These guys changed my life. These were the guys you're going to go out and meet people like this. They were onto some things back in 1990 that were way ahead of their time. Little did I know it. I thought I was going out for the beautiful city, but I met people that changed my life. And eventually I made it back to Grand Rapids, back to my home school. My journey came right back full circle to where it began. And now I'm back in my hometown. I'm not a family practice doc. I'm an orthopedic surgeon. I'm specializing in feet and ankle, which I never thought in the world I would even consider. Wasn't even on my radar before I started my orthopedic residency. My family got bigger. My house got bigger. My expenses got bigger. It was in Grand Rapids. We're going to deep dive a little bit on foot and ankle stuff tomorrow, but it was in Grand Rapids that I started developing my own ideas of the foot and ankle. That essentially carried the torch a little bit further from what I was trained in Chicago and particularly in Seattle. And Alex is probably as adept at giving that talk as I am right now. But I've had the distinct pleasure of sitting in front of a lot of residents and a lot of students and a lot of nursing students and MAs and medical students. And I can tell you that it's what keeps us going. The faculty that you have here are second to none. We do this because we love it. We've got something that I was never going to be an educator. I was not going into academics, but there was an infection in my head that I developed, passed on from my mentors, that just made me more inquisitive about certain things. And your mentors are infecting you with that inquisitiveness. And we hope you go on and do the same thing and move the needle a little further. So you're on this journey to expand your mind, but you got to find a way to do it where you can mix your family and your friends. And it's really not hard. If you look at some of the pictures, you'll see there's a lot of smiles, but in the midst of this journey, there's a lot of things you got to do. And these things can be stressful. You got to buy a house, you got to sell a house, you're all going to move. You got to learn things you don't know anything about. You got to learn about life insurance and disability insurance, and you got to learn about hospital administration, and you got to learn about CPT codes and the business side of medicine. You got to save for the future. You might have kids. You got to figure out how you're going to pay for your kids' college. I mean, these are all stresses in life. And then you're going to go through all that. You're going to have a coach on your kid's soccer team that's just a knucklehead, or you're going to have some partner that's just difficult, who doesn't follow his patients, or there's no end to the bumps that occur on this path. And you think they're ending after your residency, but they're just beginning. You're going to travel on numerous meetings. This one being an easy one, but a lot of them are going to take you to far away, interesting places all over the world, which what a treasure, what a privilege to be able to go out and see the far reaches of the world while we enjoy our profession and meet different cultures and meet other ways of doing things and carving a craft. everywhere I've gone, I've learned something about my craft just by seeing how other people do it. And it really makes the whole thing enjoyable and extremely educational. Yeah. There'll be opportunities to give back. This was after the Haiti earthquake. We were one of the first ones on the field, but what a privilege to be able to go to a foreign country and help put people back together who didn't have any resources. I mean, I would encourage you all to find a way to give back, to use your skill set, your knowledge base. And hopefully in the process, you'll have as much fun as I have. Yeah, my running career actually was just starting with that bad experience. So here in 2014, I ran the Berlin Marathon at a meeting in Germany. Yeah, but there's been so many adventures, so many friends, so many interactions, and so many influences that I'm in debt to and have immense gratitude for. And it's all those people I talked about. It's my wife, it's my family, it's my kids, it's my mentors, it's my administrators. That's my colleagues, my classmates who are still some of my closest friends to this day. You guys will never lose touch with each other because you've been in the foxhole together. Yeah, and 5 years in the foxhole, it's a special bond. So this is one of my runs. This was my run printout on my cell phone. And it was the day before we were going to do this in Grand Rapids. So I'm running the program, and I've got my classmate who's a spine surgeon, very, very prominent in Indianapolis, and he's going to be my guest speaker. He's going to stay at my house. He's on his way to Grand Rapids. I'm going to zip in a quick 5-mile run. I'm going to pick him up. We're going to go have a drink, and then he's going to come back to my house, and we're going to hang out and reconnect. Something went wrong on this run. You can see I either got lost or my phone got lost, but it takes an abrupt end about 3/4 of the way through. Yeah. And you've all heard Ford built tough. Yeah. Fords are built tough, but those of you who have ever hit a deer know what a frightening experience that can be. It wakes you up pretty fast. Well, imagine you're the deer. Yeah. So I got hit by a Ford truck going 60 miles an hour, and that's me in the emergency room. And that's 7 years ago. And Alex remembers this because he was there. Yeah. And that's me in the rehab 2 weeks later with broken arms, broken wrist, broken skull, broken ribs, punctured lung, brain hemorrhage. You look at that list and you look at that face and you think, how does that guy live? Who knows? It's a random act of God that I'm alive. And I'm one of the few guys I know who was able to give a trauma keynote address because he was a trauma patient. Not because I spent 20 years taking trauma call, but because I was a trauma patient. And you learn a lot being a patient. And I think it actually made me a better doctor because I know all the weird things patients go through when you don't know if you're ever going to walk again, you're ever going to use your hands again, you're ever going to feel your fingers or your toes. Are you ever going to be able to pursue your dreams, your passions? And this was a guy that was running 150 miles an hour. Full speed. I did 9 surgeries that day. I had a big event with a big graduation party at my house. My daughter was going to have a big party the next day. I spent that whole weekend in the ICU. And I spent the next 6 weeks in a wheelchair wondering if I was ever going to be able to do anything. And you think a lot of weird things, that the patient who is down and out, you see it from the medical side, but the patients are going through all these life balance equations. What are you going to do if you can't go back to work? Geez, I'd love to be a carpenter. I'd love to be a teacher. I want to be a salesman. What are you going to do? Yeah, which begs the question, if today was your last day, what would you do differently? Would you do different today if you knew this was your last day? And somebody's probably asked you that before, but I never thought I would ever ask that question. I was the healthiest guy I knew, but literally it was almost my last day. And for 6 weeks, I couldn't get out of a chair. Somebody had to clean me and bathe me, and I had 2 broken hands, couldn't move. What are you going to do now? If you're not going to be an orthopedic surgeon, what are you going to do? I had to sit and think about that for a long, long time. And would you do something different? So I would challenge you all to look back and say, if you could do something different, what would it be? And if not, what would you do going forward to take advantage of your short time? Life is so short. Yeah. How are you going to make today the best day of the rest of your life? And I say that often when people say, how you doing? And my answer since that truck is today's the best day I've ever had for the rest of my life. Every day is my best day. It's another day. And look at me now, you'd never know, right? I mean, for God's sakes, it's ridiculous. Yeah, but when I look back, there really wasn't anything I would have done differently. I was living my dream. I was that little kid with a poopy diaper thinking I was going to ride a tractor on a farm, maybe get into college, maybe go to med school. Went on a journey that I never possibly imagined, traveled all over the world, did a lot of research, and have given many speeches. Yeah, none of that was anticipated. It was my journey. It just took me somewhere. But all of those steps were an opportunity to reach a new height. If anybody that's ever seen the movie The Alpinist, if you haven't seen it, this is one of the mountains in that movie. It's one of the better movies I think I've seen in quite a while, but I would encourage you all to read it because that's a guy that lived life. And he definitely got outside of his comfort zone, maybe too much. I asked you, how are you going to change the world? Try and give back. But you all are the smartest people on planet Earth. You can change the world. It may be small, it may be large. How are you going to do it? Figure out a way to change the world because it's not that hard to change the world and make it better. Your staff have done it. This university has done it. The faculty have done it. The research you're seeing is changing the world. It's making people better. You guys, you've done it with the research projects you've had, but you can't stop there. That means you got to grow. You got to get out of the poopy diaper and you got to get into a clean situation. You got to keep moving forward. Moving forward means don't stand still. So this is the very first marathon I ran in 2013. This is the last marathon I ran 6 months after I got hit by a truck. One, I was disappointed, miserable experience. I was absolutely frustrated with my time. The other was the best day of my life. The last one took twice as long as the first one. My expectations were a little different. But to be able to run a marathon with my 5 kids after being in a wheelchair, not knowing if I was ever going to walk, was just a tremendous experience. It's more of a resetting of your expectations and your guidelines. But I was so happy to be able to do it again. It was just a treat. Expand the mind. I've spent a lot of time learning my craft, foot and ankle surgery. Yeah, sometimes a bunion surgery is a little mundane and routine for me now. I've got to find other things to get outside my comfort zone. Golf is one of those things. I can still play golf. Anybody that's played knows it's way tougher than orthopedics. Yeah, so I try to spend as much time as I can now taking iron and greens every day. Yeah, but I still haven't stopped learning. Leave a legacy. That may be your kids. That may be your institution, that may be your community, but do something significant and make the world a better place. And if you do so, you're going to change history. This man changed history. This is Ted Hansen, who from Harborview kind of built that hospital from the ground up when it was just a low-level county hospital that nobody wanted to work at. And he started doing things at Harborview Hospital that just made sense to him. And he was criticized for years for doing things like plating open fractures and rodding femurs immediately and taking people straight to the OR and amputating mangled legs. All of those things got him reported to the state board and to the authorities, but it made sense to him. He then did the same thing in the foot. He stopped taking trauma call. He transitioned to the foot and he started doing things in the foot that had never been done. And now he's got 3rd and 4th generation descendants of things that he taught me and I've taught Alex, and Alex is now teaching you guys. And each step along the way, we're trying to refine these concepts and principles. And that's now a baton that's getting passed to you. You have the knowledge, the skill set. You're in a unique spot. You know a lot of things that a lot of people don't know. You've got a responsibility with that to push the needle a little bit further. So this opportunity you've been given is really just the beginning. Yeah, you're in the top of the first inning. Your game has not really even started yet. Yeah, there's a whole world of experiences out there waiting for you. And this is such an early stage of the game that you just got to wake up every day saying, last game didn't count. Now it's first bat and we got to win this game. So I'll talk a little bit about the Schwatzky zone. Schwatzky's famous in Grand Rapids, as you can imagine. Yeah. So he came on my service in his third year. So I was early in my recovery. And it was summertime, and I had a fellow who was working with me. And my daughter had just graduated at the University of Michigan, and Mike Bloomberg was the keynote address speaker. And he was telling the story of in his 40s, he's married, he's got 3 kids, he's got a secure job, but it's not the job he really dreamt of doing. He always wanted to break out on his own and do something big, but he was always afraid to get out of the comfort zone and give up his guaranteed salary because he was worried about losing his income and having to move out of his condominium, and who knows what could happen. Well, then the economy went down, he gets fired, and he wrestled with this idea. I should just take another job. No, 30 years I've been wanting to do something on my own. This is my chance. This is my chance to do it. So he did it. And it just happened to be when the internet was coming of age, and he starts a data collection company in the financial services industry and becomes one of the 10 richest guys in the world. Now he's like Warren Buffett. He's trying to figure out how to give his money away and what he can do to use it. But his point was, if I didn't step outside my comfort zone when that happened, Bloomberg News wouldn't exist. Yeah. And his challenge is the same one I challenge my kids to, and the same challenge I challenge you guys to, is you got to figure a way every day to get outside your comfort zone. Find the things that make you the most afraid. You're most scared of failing. You're afraid you can't tackle. Those are the things that make you feel most alive. And if you continually back away from those things, you're giving up on opportunity. So you've got to just continue to push yourself into things that you know are hard, going to be hard. For me, running marathons was one of those things. I started running marathons because fixing bunions became too easy for me. And running marathons were never easy. Yeah. So I would go out and run because it pushed me into an awkward, uncomfortable zone. And I'm telling Schwatzky this story while we're doing a real complicated foot reconstruction, and I'm putting screws into the subtalar joint. And I'm outlining all these angles, and he's firing the screw, and I'm not letting him use C-arm or cannulation. And I'm drawing all the pictures out for him. And time was of the essence because we had 10 cases that day. So I'm like, Schwatzky, come on. You got it. Come on. Keep up. And he visibly starts sweating while I'm telling the story of Michael Bloomberg's get out of your comfort zone. And I'm like, Schwatzky, look at you, man. The nurse comes over and dabs his forehead. And I'm like, you're in that zone right now. And he's like, Dr. Anderson, I am so in that zone. I am so uncomfortable right now. And I want to live here for the rest of my life. I want to stay in this zone. So for the next 3 months, it was like, all right, we got to go get in that zone somehow. So he would go running with me when I was in my recovery. And now it lives in infamy as the Schwatzky zone. Every third year resident comes through and they get a little sweaty when things get tight. And I talk about the Schwatzky zone. And our current residents, half of them don't even know who Schwatzky is, but he's this god that sits on a pedestal because I usually name things after things the residents do that are really silly. Like they forget to staple a wound, or they put a clamp on a thigh, or they do something that's like they turn their brain off just for a second. And there are very few residents that get through the program with something that's notable and memorable. And Schwatzky was one of the few that managed to do that. So you guys are lucky to have this guy. Yeah, and he hasn't changed a bit. So I'm going to wrap it up. Your journey is going to take you around the world and back through time, just like mine, just like all the other faculty. Yours is just beginning. Be grateful for what you got. This is a treat. I had mine taken away from me briefly. I couldn't imagine how fortunate I was just to experience the things I experienced before it got taken away from me. What an honor, what a privilege. And the days where you got that cranky patient or administrator just giving you grief and you just want to call it in and become a farmer, you got to go back to where you started and remember the poopy diaper guy that just couldn't wait to get into medical school. Because you're going to have those days, but you just got to remember how bad you wanted it and what a privilege it is to do it. Stay humble. Don't ever get so full of yourself that you can't get beaten down. It happens every day. It happens on a regular basis in this field. You're going to have patience. You're going to have outcomes. There are things that are going to happen that are going to humble you every day. So stay humble, but enjoy the small things and treasure the journey. Now, it doesn't matter where you end up. It's just, how do you get there? Maintain your integrity. You can't get that back once you give it up. Stay in your wheelhouse, stay in your strike zone, but get outside the strike zone enough to push the envelope and make yourself uncomfortable. You're going to get some losses. You got to move on from those. You're going to get some base hits. Take them and move on and step up to the plate and do it again, because every next day is a new inning. And if you continue to play like it's your first inning, you're gonna do great things. Aim high, never settle. Don't stop trying. So I congratulate the graduates. I congratulate all the residents that got into this program, because it's a phenomenal program. And the graduates who are moving on, I wish you good luck and Godspeed. And I hope to see you along the way. Thank you.
Excellent, great journey, and I'm sure there's some questions.
Yeah.
Alex, how much were you sweating that day? You said it changes scrubs.
Real problem in the OR.
Sweats.
Yeah, he's also one of those guys that in between cases would drop and do 20 push-ups just to get a little
You can
exercise.
still do that.
Yeah, with one hand.
Perhaps. Or slapping his back in between,
So
hand behind his back.
he was a unique resident.